Where do supplements come into a nutritarian diet? Because obviously, if someone is like, very, whole foods, plant-based or vegan, and I think on every different spectrum of like dietary patterns, there's always supplementation in some way, shape, or form. But is there supplements that you would obviously consider someone to take? Because for me, personally, I do take a B12 and, I take an algae-based omega-3. And that's literally it. The rest is coming from food. And sometimes once in a while, I take a zinc.
Yeah, I'd
But that's
probably
literally
add
about it.
zinc to that. Some people can take a lot of the omega-3 intake and then cut back and not eat pistachios, not eat cashews, not eat pecans, not eat almonds. Just eat the high omega-3 nuts. And in some cases, they can get enough. But it's such a dietary gymnastic and such a radical way to do it. And also, you can get exposure to too much cadmium if you eat so much flaxseed. You know what I mean? So we're talking of
Mhm.
too much of one food. So I don't really recommend that, but I have seen, so but I'm certainly not saying that every person needs an omega-3 supplement needs to take, but I am saying that if you are trying to raise your level without taking the omega-3 supplement, at least get the blood test to see that what you're doing is working. Don't let your omega-3, because I'm recommending an omega-3 index above 5, maybe ideally even above 6. But don't let your index get, below 4 and think you're okay because you're eating flax seeds. These people do wrong is they believe theories and opinions and people telling them that they don't have to worry about it and they don't have to look at their blood. So they're just not even, so the time that damage happens and the brain shrinks, it's going to be too late for them to fix it. I'm saying if you want to believe something that's a little far-fetched, then at least check the blood test and at least make sure your index isn't too low because we have too much data and too many studies showing a low omega-3 index puts you at higher risk.
Yeah. Obviously, and everybody's so bio individual as well that like conversion rates are going to be completely different towards different people as well.
Yes, that's right.
Nobody's
It's
going to
very
be the
genetic.
same.
To be able to convert the ALA into is longer chain fats is very genetically dependent too. That's correct. Some people can make enough, and other people can not, no matter what they do. So it's
Mm.
very important to know your level. So I'm warning people against those individuals who are telling people that the omega-3 index has no value and don't even care about that. You don't have to worry about it. You do have to worry about it. So if you don't want to supplement, at least check the index to make sure you're okay.
So a week ago, I put out on Instagram to see if anybody had any kind of questions for you. And most of them actually have been answered throughout this whole entire discussion. However, there's two that have come up that very, one is more towards folate and folic acid and the difference there. Um, and I know I've heard you talk about this quite a lot in the past, and maybe if you could touch on that for the people that are kind of confused on what's the difference between folate and folic acid, and why we shouldn't be taking folic acid.
Yes, and I even in this discussion I mentioned earlier about children getting acute blastocytic leukemia, which I'm making this really radical claim, and I'm the only one I know that's making this statement. And I'm saying that advocating women of childbearing years take folic acid supplement is creating an epidemic of cancer in children because we need folate from green vegetables, and it's the low green vegetable diet that contribute in the mother's diet that can contribute to cancer. And yes, folate is the natural form that we get when we eat food. And we're supposed to be eating a diet rich in folate and getting our food, the folate in the form of folate, not in the form of folic acid. Folic acid does not exist in nature. That's a synthetic form. It's made in a laboratory. It's like giving people a drug instead of taking the real thing. So it's like a drug form of folic acid. It penetrates the cells too readily. And even though it can help with neural tube defects, it has damaging effects on an increasing risk of breast cancer, prostate cancer, and colon cancer. So the major long-term damage from taking folic acid is increased risk of breast and prostate cancer, and that's been shown in numerous studies already. And the folic acid is fortified. All these foods, soy milk is fortified with it. Nutritional yeast is fortified with it. Your supplement has it in it. Your bread has it in it. People are taking folic acid left and right and not realizing even on a vegan diet, they're increasing the risk of breast or prostate cancer from all the folic acid they're taking. And our folate levels in the blood are high, even outside of the normal range. We don't need to supplement with folate. Our diet is high in folate. Green vegetables and beans are very high folate containing foods. And nature did not mess up, and that we need to take a synthetic folic acid pill to prevent neural tube defects. The point I'm making, if we utilized the desire of women to not have children with neural tube defects, that would be a great educational opportunity to inform women of the need to eat green vegetables to get their folate. And when that happened, that would have protected against more than just neural tube defects. It would have protected against heart defects and against childhood cancers in their offspring and brain tumors from eating green vegetables. Instead, by giving a synthetic folic pill, we reduce neural tube defects. Now we increase the risk of breast cancer in the offspring and in the mother. And of course, we increase risk of childhood cancers. So yes, I'm an advocate of not taking folic acid, but instead eating a folate-rich diet. And a folate-rich diet lowers risk of cancer, and folic acid supplements increase risk of cancer, right? Particularly when people aren't eating the folate richness of their diet, and they think they're okay because the folic acid gives them the permission where they don't have to eat the high folate foods, which have other protective benefits.
Yeah, it's only recently in the last I would say 5 years for me that I've realized how much it is in food. So you look at your breads, your pastas, and it's literally in everything. You go throughout like the whole food section, and like anything that is very kind of like refined has folic acid in it, and it's just mind blowing to me.